Hi, Ma'am Sir. This is our research entitled Hand Sanitizer and Non-Contact Temperature Measurement, prepared by Elias Sonchon, Peter Jan Gutierrez, Laris Babiera, Jador Vallejo, and Jomal Bautista. Chapter 1: Rationale of the study. To help avoid the spread of coronavirus disease 19 or COVID-19, this research aims to create a machine that automatically dispenses hand sanitizer and measures body temperature. The machine utilizes an open-source Arduino-based platform in order to be programmed to control the system of dispensing the hand sanitizer and measure temperature. For the hand sanitizer, a proximity sensor is used to detect nearby objects without any physical contact. On the other hand, an infrared or IR sensor module is used to measure the heat of an object as well as to detect the motion. The machine eliminates the frequent use of a handle to prevent physical contact and further transmissions of the disease. Next, introduction. In this study entitled Automatic Hand Sanitizer Dispenser with Non-Contact Temperature Measurement is an experimental research to create a machine that will eliminate bacteria, disinfect objects that has been contaminated with infection diseases or viruses, and especially to help avoid the spread of coronavirus, also known as COVID-19. Now this day, the demand of hand sanitizer has increases as coronavirus broke out and spread throughout the world. Hand sanitizer usually applied by squeezing the sanitizer liquid, also known as alcohol or isopropyl alcohol, out of its container. This causes people to come in contact with the sanitizer handle, which increases the transmission of virus or bacteria. Moreover, each person presses the container and increases the possibility of contact to the person, which possibly carrying the viruses. For this reason, by creating this machine, the actual contact to the sanitizer container will reduce, and also by applying the non-contact temperature measurement, also known as thermal infrared sensor, will help to monitor the body temperature of the people, which help to avoid the spread of the virus. Next, statement of the problem. COVID-19 has been significantly increasing over this past month. Consequently, demand for this disinfectant and disinfectant tools rises at the same time. Specifically, demand for hand sanitizer has been surged since the coronavirus broke out and spread around the country. Typical hand sanitizer needs to be pumped by use of palm use may lead to people come into contact with the pump handle that may increase the risk of transmission. Therefore, automatic hand sanitizer was designed in order to prevent transmissions of viruses and being sanitized without having a risk of being infected. Furthermore, it can be operated compatibly despite of huge masses in a public place because of its uncomplicated and much easier to use. Moreover, this device can still be used despite of disinfectant liquid is already low by refilling it. Users do not need to refill the purchase container for the liquid disinfectant. Thus, it is economically and eco-friendly by decreasing waste emission. This automated this automated hand sanitizer will be greatly benefited to everyone that uses it, especially people in public places, market, restaurant, and place with the with the masses of people because of its contactless and hand disinfections and having much easier access to the device. Next is the objectives. The objective of this research is to create an automatic hand sanitizer dispenser with non-contact temperature measurement system that will be used for sanitizing and measuring body temperature simultaneously. Specifically, this study aiming to attain the following: to create a device that will eliminate harmful organisms like virus, to help establishments like hospitals, pharmacies, malls, and etc. to monitor the body temperature and sanitize the people who is entering and leaving the establishment, to make the Philippines a COVID-free country, to help the people avoid any harmful organism like virus. Next is the significance of the study. This study entitled Automatic Hand Sanitizer Dispenser and Non-Contact Temperature Measurement is an experimental research that focuses on designing, modeling, programming, and creating a device that will help people prevent infectious diseases and viruses and also for monitoring body temperature. Moreover, the result of this study will benefit the following. Number 1. The people. The result of this study will help the people in the Philippines to be aware about the value of hand sanitizer, especially in now pandemic. This way, they can avoid being infected by any harmful organism like coronavirus. Healthcare practitioner. The result of this study will help the healthcare practitioner sanitize and monitor the body temperature of people who is entering and leaving the hospital, and also they can always sanitize their hand before and after meeting the patients. Number 3. Establishments like pharmacies, malls, and public places. This study will help the establishment like pharmacies, malls, and public places to disinfect the people who is entering and leaving the establishment to avoid the spread of any harmful organism like virus, especially COVID-19. Last, economy. The result of the study will help to the economy to go back to its normal condition because researchers found that not only humans, pharmacies, malls, restaurants, and etc. should give preservations and importance in this pandemic, but also we should know the economy is in the line that we have keep. Scope and limitation. This study focused on the modeling, designing, programming, and creating an automatic hand sanitizer dispenser with non-contact temperature measurement. The automatic hand sanitizer system will be presented in three stages: the instrument structure, control design, and hardware design. Instrument structure is the actual planning, technical drafting, and modeling of the hand sanitizer system by using SolidWorks, AutoCAD, or other 3D modeling softwares. This way, the researcher will determine the actual measurements, length, width, and height of the device and also the appearance of the final output. Control design is the actual programming to control the system of the hand sanitizer dispenser by using Arduino or the IDE or other programming softwares. Lastly, the hardware design it is the actual applications of the previous two stages, like instrument structure and control design. It is the stage that will put all the parts together and create a functioning machine. The researcher considered working on this study to find out if automatic hand sanitizer dispenser and non-contact temperature measurement is a device that will help to prevent any harmful organisms like viruses, especially COVID-19. This study focuses on the creations of the machine and also to make all the parts of the machine work together and how it will benefit others. Next is the location of the study. Due to a rising number of the people infected by COVID-19, the researcher will study will be conducted through online to protect the researcher and to prevent the spread of viruses and other infections. The researcher will have different tasks to fulfill via online strategies as a means to follow the device provided by local health authority, health protocol by the government, such as social gatherings and social activities are interdicted. Chapter 2. Review of related literature. In this pandemic, alcohol-based sanitizer are commonly used as sanitizing agent for prevent infections and kill bacteria, fungi, and viruses. According to the article entitled Hand Sanitizer and COVID-19, How is COVID-19 Impacting Demand the Alcohol-Based Hand Sanitizer Market? Stated that the market landscape of the hand hygiene products has drastically changed since the outbreak of COVID-19. The average market demand across the globe is likely to witness a phenomenal rise of over 600% during 2020. It means that when COVID-19 spread throughout the globe, the average demand of the hand sanitizer drastically increased by 600% globally during 2020. Alcohol-based sanitizer are the major contributors to the global hand sanitizer market, and there are two types of alcohol-based sanitizer named ethyl and isopropyl alcohol. The ethyl-based sanitizer segment has witnessed tremendous growth Since the impact of the COVID-19 pandemic, the growth opportunities can be attributed to the fact that these ethyl-based sanitizers are 40% more effective against viruses than normal sanitizer. Isopropyl alcohol or 2-propanol, also known as isopropanol or RPA, is the most widely applied sanitizing agent in pharma, hospital, cleanrooms, and devices or surgical equipment. Since the coronavirus infection has rapidly increased globally, the sanitation of products have become mandatory for healthcare practitioners.